Hi, everyone. So we're here today introducing Dr. Gluzman. She is a holistic pediatrician based out of New York City. We are so excited to have her here and to have her expertise to share it with all of you here with us today. What we're going to do is basically she's going to present, and then it's going to be open to question and answer. Anyone during the presentation has any question, just please put it in the chat below, and then we will highlight the questions at the end so we can answer everyone's questions. I would also love to give everyone a taste of like how you came into holistic pediatrics and what is your background and how you came to this change of practice. Because from my understanding, Dr. Gluzman, you weren't always practicing from this this place of holistic approach. I'm sorry. So I would love to share a little bit. I'm going to actually mute myself because I think we find is that oftentimes when we're both on, it gets a little bit more broken up. So I'm going to mute myself, and Dr. Gluzman, I'm going to let you just take over.
Okay. Thank you so much. Thank you so much for having me on. I am delighted to speak to you all today about a topic that I love so dearly. A little bit about my background. My name is Dr. Nelli Gluzman. I am a pediatrician. I practice out of New York, and I consider myself a holistic pediatrician, which is kind of rare. And the reason why I consider myself a holistic pediatrician after being a conventional pediatrician for so many years is because of a personal story. So I'm a mom, and I have been working with the sickest kids in the hospital setting for, I would say, at that point, about 8 years. So specializing in hospital medicine, I would treat asthma and eczema and pneumonia and intensive care unit patients, newborns that were born really young and needed a lot of support. I worked in an emergency room or emergency department, or so exposed to the sickest kids. I felt like I was a great pediatrician, and I knew what I was doing when it came to bad illness. And then at some point, when my child was about 3 years old, she started getting sick a lot, and not just the kind of sick where you have a virus and you're sick for a couple of days with a fever and a little bit of cough. This was different. Every single viral illness would turn into a full-blown bacterial illness, something that required antibiotics. And the same thing would happen to me. At one point, I think both my daughter and myself were on antibiotics about 7 times in the course of one winter. And I could not believe that I did not know, as a pediatrician, how to prevent these illnesses and what health really meant. And I knew how to treat the bacterial illnesses like amazing. I could treat any bacterial illness. I could take the sickest kid and get them better, but I couldn't prevent any of this. And so I was frustrated. I was scared. I was confused, and I felt like I was missing a really big chunk of understanding of what health really was, and how I want to practice, and how I want to live my life, and how I want to be healthy, and how I want my daughter to be healthy. And so I embarked on a really deep, thorough journey into functional medicine. I was trained by the Institute of Functional Medicine pretty extensively. I learned nutrition. I am the sole pediatrician in New York to practice something called the GAPS protocol, which is deep nutritional healing through mostly dietary changes. And so now I'm coming to you live from my practice in New York, Blossom Pediatrics. And today, I would like to talk to you about a topic that I think we could all relate to, and it's just pediatric fever in children, and what we do with it, and debunk some of the myths, tell you about from both a holistic perspective, but also as someone who works in a hospital with the sickest kids. And so I want to tell you what the options are, what to look out for. So thank you so much for having me on. I'm going to jump right in. So today we're going to talk about not only what is fever, but also the most reliable way to measure temperature, something that we all do a little bit differently, and I'm going to talk to you about the most evidence-based way to do it. Evidence-based meaning there are extensive, excellent studies done to prove that something is done right. I'm going to talk to you about what causes fever and what the purpose of the fever is in the body. We'll talk about when to see your doctor or pediatrician when your child has a fever. How to keep your child hydrated during fever, one of the most important topics that we'll cover today. Natural and holistic remedies for colds and fevers, and also how to superpower your child's immunity. So to start, what is fever? My child has low-grade fever. This kid has a low-grade fever, but that is actually not a term. It is important to get a reliable measurement of a temperature so you can take appropriate actions. So a fever is exactly more than 100.4 degrees Fahrenheit for core temperature. There is also something called low temperature fever, and that is a temperature less than 97 degrees. This is very rare, but I wanted to tell you about it because it does affect children who have congenital issues or developmental delays, neurological issues. The fever, premature babies, that fever could be actually low temperatures. So not all fever is hot, but most is. Now, there's many different ways to measure temperature, and it is important to know what's the best way. There's so many options, so many options. So the general idea is if a child is less than 4 years old, we measure a temperature through a rectal thermometer if the child allows you. If the child is more than 4 years old, then that would be peripheral method. What is a peripheral method? That's anything outside of the core, and it varies a little bit. There are a lot of options. There's the classic oral, which is under the tongue. There's the tympanic, which is a newer digital version. And so another newer digital version of measuring temperature is forehead measurement and axillary under the armpit, also classic. So looking at a lot of different studies, a lot of different recommendations about how to measure. And the most recent, most robust study that I found was that if you're going to measure not rectally, but peripherally using a digital method, the most accurate and precise way to do this is actually the tympanic, the in the ear thermometers. That's the closest to the core temperature if it's done in both ears, kind of taking the average of both. The least accurate is actually the forehead temperature. Now, you cannot measure ear temperatures in kids who are under 3 months old. And so I would say definitely a kid that's under 3 months old, always rectal, newborns to a 3-month-old, rectal temperature will give you the most precise way to get the temperature. Kids who are more than 3 months old, you have options. But if I was going to measure temperature after reading that study, and I needed a new thermometer, I would go with the in-ear one, tympanic. And you can use that all the way up to adulthood. So I give this lecture to medical students and medical residents and understand or know or really care to think about very often how a fever works and why it happens. So a fever is an increased body temperature with an increased hypothalamic set point. That is the part of the brain that tells you how high that temperature could be. Hyperthermia is different. Hyperthermia is when you have an increase in body temperature with a normal hypothalamic set point. Now, if you want to go into the nitty-gritty of how it works, I think it's pretty interesting. I'm going to just summarize what happens in the body when there's a fever. So there is a type of white blood cell called a phagocyte. It sees an antigen or an invader that shouldn't be there, and it attacks. And when it attacks something that shouldn't be there, like a virus or bacteria, you have that phagocyte creating a lot of different chemicals. Let's call these chemicals cytokines. Once they're produced in the phagocyte, these cytokines are released into the blood. They go into the part of the brain called the anterior hypothalamus. It's kind of in the middle, And that part of the brain creates a chemical called PGE2. That PGE2, when it's produced, raises the brain's hypothalamic set point, allowing the different blood vessels in the body to constrict. And when that constriction happens, you conserve heat to raise the core body temperature, but it also produces shivering because of the heat production. So someone with a fever might feel cold because of the constriction, but it's really conservation of heat. Other things that these cytokines that are produced in the phagocytes create are things called acute phase reactants. Those are the things that help your body fight infections. They do this by creating more white blood cells. So if there's a problem, white blood cells see the problem, they make changes in the body to bring even more white blood cells on that help fight the infection. They also produce chemicals that help slow wave sleep so you can rest better, fight the infection. They do these things while decreasing zinc and iron levels, something to consider when you're thinking about conservative management of fevers and illnesses. Now, why does this all happen? Simply because a lot of viruses and bacteria do not thrive in these high temperatures. They thrive in normal temperatures. So when the body raises the temperature, they start to die off. So a lot of times I get this question, does the height of the fever correlate to the severity of illness? And it actually does not. A lot of viral upper respiratory infections, also known as the common cold, can present with very, very high temperatures. A lot of bacterial infections can present with lower temperatures. Now, what does correlate with severity? What tells you if there's a big problem? Something to consider is if a fever has a very poor response to antipyretics. Antipyretics are the things that lower fever. Those things are usually the Tylenols, the Motrins, the acetaminophen and ibuprofens. If there's a poor response, if there's a high fever and you're giving these antipyretics, Tylenol, Motrin, ibuprofen, acetaminophen, whatever you want to call it, and the fever is just not budging, that might be an indicator of serious illness. Also, an indicator of serious illness is increased fever curve, meaning the fever is over the course of several days, usually 3 to 4 days, the fevers are getting more frequent and higher and more frequent. So what are usually the three things that when asked many people and in many studies that I saw, the top three illnesses parents and a lot of medical professionals too are afraid of are fever, cough, and meningitis. Fever alone is the reason why 5 million ER, emergency room, or ED, emergency department visits happen every year. But a fever with a viral illness is very normal and it should be happening because you're fighting the infection. And it's very common, very normal for some fevers with really common colds to last about 4 to 5 days. Now, skipped a slide. So is it possible to burn up? Is it possible for a fever to be so high that there is a big problem? Why is there such a fear of very high temperature? There are things to be afraid of, but you should know that when there's a fever due to illness, there's a glass ceiling of a fever. There's a maximum, and that maximum everyone in medicine knew about since the 1940s. At that point, when you reach the maximum, there's a natural turn-off mechanism, and it's really rare for a temperature to go above 105, and it's really not high enough to cause any serious illness or any serious problems. So having a high fever should not be a concern for a parent's normal radar. Now, it is possible to go over that glass ceiling for a different reason, which is called hyperthermia. That only happens if there's SSRI syndrome, which is caused by certain medications, very rare, when this is from weather outside or especially dry heat. That is dangerous. and the temperature can go above 105, or with a different type of medication called an anticholinergic. And so if your kids are on these medications, you would know about it because your pediatrician or doctor would tell you about it. So my biggest pet peeve, what we're doing, is it safe? Are we treating fevers with something safe usually when we're using Tylenol or Motrin? They're so popular. They're used everywhere. Everyone's using them. Hospitals, parents, it's on every shelf in every pharmacy. So a few things you should know. How does Tylenol work? It depletes something called glutathione. Glutathione is the body's main detoxification system. Tylenol use is also linked very closely to asthma exacerbations and liver toxicity. In fact, in many countries, you can only buy Tylenol when it's sold by a pharmacist. You can't buy it over the counter, and it comes with maximum doses. They won't sell it to you for more dose than is needed. Other countries, they use a lot lower doses because of this problem with liver toxicity. But what about Motrin or ibuprofen? Well, 5 days of ibuprofen use is very closely associated with gastritis and acute kidney injury. And these are real things that I see happening in the hospital setting all the time. Those are concerns to me as a pediatrician and as a mom. We, about 30 years ago in the US, that was pretty popular for fevers. It was using alcohol and a bath to lower temperature. But that was really unsafe. It was a major cause of nerve damage, and now it is no longer recommended by any doctor or pediatrician. So I ask myself, and ask you to really ask yourself, whenever you're treating something, is the treatment more dangerous than the actual cause? But there are times when fever is always dangerous. For example, when should you take your kid to the emergency room or emergency department, also known as ED or ER? When you have a child that is less than 3 months old with a temperature more than 100.4, that is always an emergency. That temperature should always be measured rectally. And if there is a temperature more than 100.4 in any baby under 3 months old, that is right away, go call your doctor, go to the emergency department. Why? Because babies under 3 months have a 10 times higher chance of having a serious bacterial illness with fever. And if a baby was born prematurely, meaning less than 37 weeks, the 3 month becomes actually a baby under 4 months old. You have to adjust for that prematurity. I would also say that any child less than 6 months old that has a temperature more than 103.5 should also be seen by a pediatrician. And the golden rule in medicine, and what I teach all my medical students and all my residents in hospital setting, is, does the child look toxic? What does that mean? Does the child look really, really sick? Then it's always a reason to go to the emergency department. There are other things to be concerned about. For example, sometimes seizures can happen with fever. Usually it's a febrile seizure, and it's not the height of the fever that causes a febrile seizure. It's the change in temperature. And so it's usually not something that you can control. You can't really prevent it from happening. It's 4% of children between the ages of 6 months to 6 years can have a febrile seizure. It is not linked to having seizures in the future. It's usually not dangerous unless there's a fall from it. So I don't mean to scare you, but if you feel like your child is staring off into space or having abnormal body movements and is sick and is starting to have a change in temperature, and you're worried about it possibly being a seizure, you have to go to the emergency room right away. The biggest danger, the most common reason why kids get admitted to the hospital is with fever, due to fever, is not the fever, it's the dehydration that happens. When does that happen? Because of a lot of vomiting or diarrhea, because of the kids can't keep fluids down, or they're refusing to drink, or if there's no urine in about 6 to 8 hours, that's a reason to see a doctor. Another reason is lethargy. What does that mean? It's a term that's used a lot, but what that means to me is a child that is sleepy, that cannot be woken up, very irritable or fussy, difficult to console and consolable, acting confused, not answering questions appropriately, or having poor eye contact. Those are reasons to always, always, always seek medical attention right away. Other reasons are if there's fast, hard breathing, if there's trouble breathing, if there's a rash, which could be normal, but something that's important to see your pediatrician about. If there's pain or stiffness in the back of the neck, or the child is kind of not able to move their head left to right, what that looks like in a younger child is they move their whole body to reach their favorite toy. And so the way we test kids when we're concerned about that is just hold something that they love kind of in the periphery on the side and see, are they grabbing it with their hand but not moving their body? Or are they turning their head to see it? Or are they moving their whole body very, very carefully to touch it? If there's a severe headache in an older child, those are indicators of possible meningitis and absolutely need emergent medical attention. If a fever lasts more than 4 to 5 days, also important to get medical attention. Again, if there is poor response to Tylenol and Motrin, if you're using antipyretics, if there's an increased fever curve, if the fevers are more frequent or more higher and higher and higher over the course of about 3 to 4 days, or if there's improvement of illness and then suddenly there's worsening of everything and worse, higher fevers. That could be a sign of a viral illness turning into a bacterial illness or a bacterial superinfection. The most important also, well, not the most, but one of the most important things to always think about is your gut intuition, your parent intuition, your caretaker intuition. Is your gut telling you that there's something wrong? Then yes, seek medical attention. But there are benefits of fever. The increased immune response that we just spoke about, that's huge. Your body knows what it's doing. And it also slows bacterial and viral activity if there's a fever. So reducing fevers with antipyretics without strengthening the body and helping it fight infection is almost dangerous. It can prolong illness. But there are so many things we can do to also strengthen the body, and we'll talk about that. I would say, so the question is, when do we treat fevers? Either holistically or conventionally with antipyretics. Well, one reason to treat a fever is if a child is so uncomfortable that they can't sleep, I think that's a reason to treat a fever, because sleep is fundamental to healing. If your child is so uncomfortable that they won't drink anything, that's a reason to treat. Why? Dehydration is a lot more dangerous than fever. Dehydration happens very quickly in children. And this is, again, the most common reason why kids get admitted to the hospital with fever. So, because there's increased insensible fluid loss with fever, meaning you're basically through every single pore of your body, because you're breathing faster and you're sweating everything out, you're a lot more fluid and electrolytes when there's a fever. And so more fluid intake is generally needed if a fever is happening, because dehydrated really quickly. So how do we keep our children hydrated? A common way to do this is to go to the drugstore or the supermarket and buy something called Pedialyte, which is tailored to children. And so Pedialyte is fluid. It has a dextrose, wonderful. That's the sugar that we need for hydration. It's an electrolyte, sodium electrolyte, potassium electrolytes. But there's a lot of other ingredients that are really, really dangerous. The Pedialyte ingredients, for example, the grape Pedialyte, artificial grape flavor, sucralose, isosulfamate potassium, coloring like FD and C, red number 40, blue number 1, those are all known carcinogens, basically poisons. Those are all known to cause problems in the body. Are there other ways to prevent dehydration? Something else you could buy in a drugstore or supermarket is instead coconut water. It does have the same natural sugars and electrolytes that are needed. You could use these to make jello, popsicles. You could use them instead of water in smoothies. Herbal teas can be calming, soothing, and anti-inflammatory. Chicken soup, of course, bone broths, regular chicken stock, vegetable broth, they're hydrating and healing. My favorite electrolyte rehydrator, a lot of these things are found in your pantry or in your kitchen now. And so I think, in my opinion, this is a lot safer to use and a lot more effective when you make it on your own than buying store-bought preserved Pedialyte or Gatorade, for example. So a rehydrator that I use for my child is adding lemon juice, baking soda, salt, some kind of sugar, usually in the form of maple syrup or honey, and drinking it. Making ice pops is a trick that we use in the hospital to rehydrate kids who are not wanting to drink anything. It's really hard sometimes to get a 1 and 2-year-old to drink. If they don't want to, that they won't want to, but they will most often will take an ice pop, and you can make that yourself by adding teas and frozen berries and putting it in a blender and sticking it into an ice pop mold. I love putting herbal remedies in there too, like echinacea tincture, because those are sometimes bitter and kids don't want to take them on their own. There are so many different beautiful healing and soothing teas. I actually have a guide that I made for you all. I'm going to post this guide of my favorite remedies and also things you can make at home, things you can buy in the store, in the chat box at the end of this presentation. And it's an ebook. It's yours free to use. It's always changing. I'm always adding things to it. Though it's the stuff that I love and I use for my child. So there are ways to treat a fever. There's a holistic approach. There's making sure that you're getting the right supplements like zinc, vitamin D, vitamin C, probiotics, and using Tylenol or Motrin. By the way, Motrin or ibuprofen can only be used on kids over 6 months old. So a question that I ask myself all the time is, because I call myself a holistic pediatrician or natural medicine practitioner, is what is it really? And there's really no one definition of this. So I kind of dug deep into my heart and asked myself, what do I consider holistic medicine? And so I used this criteria that I created to create this ebook. And what that means to me is that this medicine, which is holistic or natural, does not cover symptoms, but helps to treat root cause. It supports the body to heal itself, which means it helps the immune system fight infections. And sometimes it can bring down fever naturally. That it does not cause harm, that this product does not have chemicals or preservatives that ultimately can be harmful to the body, to the microbiome, that it is made and produced mindfully, and that most important, that it's evidence-based, meaning that there's plenty of double-blind, placebo-controlled, high-quality studies to back the ingredients in the products that I use, or the remedies that I recommend that are holistic or natural. So I'm going to tell you some of my favorites to lower fever and also to superpower the immune system. But most important immune boosters and illness busters are eating well. What that means to me is eating as much as possible local food, organic food, fresh and real foods. Eating plenty daily of probiotic-rich foods, sleeping well, getting the right amount of consistent high-quality sleep. And I like to add having gratitude in our lives and for our bodies. I think that the mindfulness component is extremely important when talking about a whole body health and holistic medicine. So my favorite, one of my favorite ways to treat fevers and remedy illnesses, is homeopathy. And I love it because it's safe, which means there are no interactions or side effects. They are gentle. They're evidence-based, which means there are plenty of studies to back them up. They're choice medicines for infants, pregnant women, and nursing moms. They are easy to take. The pellets are sweet, the liquid is sweet, and they're individualized. You could really individualize the symptoms and the experience of an illness. So in my guide, you'll see me recommending cold remedies from a brand called Boiron. But if you can't get to a homeopath, which is a specialist in the field, these are wonderful remedies to buy. Another homeopathic remedy that I love is called Umka Cold Care Syrup. There are fever remedies that could be used for specific types of fevers, like belladonna, Corynebum napulus. So there are many different ways to do it. There's guides online. You can look at my guides to see which one works best for you. And I will not leave my home or travel without these remedies. As soon as I feel a cold coming on, and I'm constantly surrounded by illnesses when I work in the hospital setting. I mean, I'm constantly surrounded by viruses and kids coughing at me. I will not get sick if I take these some of these cold remedies as soon as I feel cold coming on. There are a lot of amazing, beautiful herbal remedies. Herbal remedies are usually plant medicines made of seeds, berries, roots, leaves, barks, or flowers. They could be made into things like tinctures or teas or salves. There's so many ways to take them. I like to think of herbal remedies as either daily immune boosters or preventatives or treatments for illness. My favorite daily immune boosters, things that prevent illness, especially now that we have winter coming on and cold season and flu season, is astragalus. This is a very deep immune boost that also supports the microbiome. It could be used daily in a very safe way. Garlic syrup, elderberry, our famous, beloved, delicious tasting elderberry syrup, and things like, I mean, there's so many. Horseradish root, cinnamon, ginger, thyme, meadowsweet. A lot of homemade or store-bought remedies have a combination of all these, and so they're really big power boost to your immune system. Some treatments for illnesses are things like echinacea, vitamin C, and lemon balm is one of my favorites. It's also an antiviral and fever reducer. I put propolis because it's made from bees as an herbal remedy. It's not really, it's a live remedy. Also something that I would never leave home without to boost the immune system and to fight a cold or any illness. Teas and oils are really interesting because they're pretty safe. Nose oil works wonderfully for congestion and mucus, especially when it's a mix of like a calendula and essential oil. Saline for the nose really thins out mucus secretions, allowing things to move whenever there's stagnation in the body, like with congestion or a viral upper respiratory infection. Whenever things are not moving because of a lot of mucus, bacteria can invade. And so to prevent that from happening, we want to thin out the secretions and get the nasal passages nice and open. So saline is really important, especially for the little ones that can't blow their nose. We use saline, but a lot of store-bought saline, like I mean, almost all, they have a lot of preservatives that shouldn't be there, and they're actually drying and irritating to the nasal mucosa. Saline is just salt water. So there's a brand that I like called X Clear, and I think some pharmacies sell them, but I buy mine online, and they have no preservatives. They're safe. There are a lot of different options, and you could find the brands that I love on the book that I'll post in a few minutes. There's also ear oils to fight ear infections. They usually have some kind of garlic in them. There's herbal chest rubs to allow for congestion to kind of clear up, and herbal steam baths. Something that I forgot about, and then my parents reminded me, and this is an old remedy for fever. So it's safe and it works. In the hospital setting, what we do is we take cold packs and we put them in key places in the body, like the axilla, the groin, and the forehead. You could do the same thing with cabbage leaves, because cabbage leaf is, if it's cold, it actually draw out the height of the temperature. The cabbage, when placed on the forehead, the cabbage leaf will wilt eventually. You could reapply it, but it's an ancient remedy. It works really well, and I've seen actual studies to back it up. Another way to do it is a vinegar. My favorite vinegar is apple cider vinegar, and putting that on a sock, or diluted in water, or on a forehead, or on a tummy, wrapping it, and then also decreases the temperature of the body. So there are so many remedies. I am going to right now actually post the link to the PDF that I created. There are so many remedies. I'm always learning. I would love to hear about your natural, your holistic, your favorite family remedies. Please reach out. You can find me on social media. It's my tag is @Dr_Gluzman. My website is blossompediatrics.com. This is where I'm coming to you from. And so I am going to take some Q&As now. Thank you so much for listening.
Dr. Gluzman.
Yes.
Thank you so much. That was so informative. Thanks for giving us all of that information. We're going to open up to the question and answer now. Let me see see this one, Josh, public. Okay, so let me see. Sorry, this one. Okay, so we have a question here from, how do I do the quote here? I'm just trying to figure this out. 1 second. Show question list, maybe that's what it is. Sorry, we're just trying to figure out how to post that. So we have a question here from, it looks like, is this Tammy or Tama? Do you see that? Okay. So I love all of this. Our pediatrician just looked at us as if we had two heads when we had concerns and asked about safety of Tylenol. Question number 1, does Dr. Gluzman accept new patients? Okay, Dr. Gluzman, you are accepting new patients, correct?
Yes, I am accepting new patients. You could actually, book a call, a free consultation to talk to me about whether or not my practice is right for you by going on my website. And so, if you have any general questions about how to approach an illness, a lot of my patients are younger children, healthy, and they just want to kind of make sure that they stay healthy. I see a lot of kids who have a lot of serious illness and chronic illness, with allergies and asthma and eczema, and so their parents are sick and tired of using steroids, for example, to kind of cover up the symptoms of a bigger problem. So I get them back. I basically solve mostly through holistic approach, a lot of functional medicine, a lot of high-tech testing. We heal. We really heal a lot of chronic illness. I have a lot of kids who suffer from gastrointestinal issues like constipation or diarrhea, or a lot of bloating, food intolerances. They've been to their gastroenterologist who recommended medicines, for example, like Miralax for constipation. And I get these kids with their parents off all these medications and thriving, healing, growing. So yes, I'm accepting new patients. And you could book a visit with me or just a free consultation on my website, blossompediatrics.com.
That's amazing. Yeah. That's so wonderful that you offer the free consultation for the 15 minutes so people can become acquainted. That's really, really special. And then her next question is there a plain English article regarding acetaminophen and glutathione depletion? Maybe something, Dr. Gluzman, maybe that you wrote that we could share with friends and family.
Oh, yeah. Yeah. You know what? You guys are all following on Enriched Parenting. Actually, this is like a passion project of mine, because I feel like this topic, fevers and treating them, it's just such a huge scale. I mean, who hasn't had a child with fever and treated with days and days and days and days of Tylenol and glutathione? And so I would love to share this with you. I have writings on this. I teach about this in the hospital where I practice. I teach medical students and residents about this. I think this requires a lot of attention. So when choosing to use these medications, they're used wisely, and alternatives to using these medications are known. So you have options besides some of the standard acetaminophen and ibuprofens. Yeah. Oh, and I see everyone, Tamara, you wrote, everyone around me is giving Tylenol for fever freely, and they think it's safe. How can we explain it simply? Well, yes, it might appear that it's safe, and usually it's safe, but because it doesn't actually help anything. So maybe it's safe in the short run, but many years of using these medications does cause issues. Maybe small changes that you might not see right away, like maybe you won't get a rash or a big problem right away. But I don't think it's safe to use anything potentially harmful. If the risk outweighs the benefit, then it's not considered safe. So how I can explain it simply is I think that pediatricians, doctors, parents, everyone needs to just educate themselves on all the risks. So that's why I'm giving this presentation, options and risks. Is elderberry safe while pregnant? I believe it is. I don't treat pregnant women, so my information on this is very limited, but I would say if you're concerned about any kind of safety for an herb, definitely consult with your regular doctor first. And also, there's a book that I go to for, well, I have my doctor guide, so I would consult with like something called Lexicon. We have a database of information a pharmacist would know, but also ask whoever's making the elderberry, because elderberry is just a berry. So the actual berry itself is considered to be, I believe, safe as during pregnancy, but there are other things that could be put inside of it that might not be safe. And so wherever you're getting your elderberry syrup concoction, also ask about whether or not there's alcohol in it to preserve it. That might not be fully safe or not something that you might choose to take while pregnant. So always look at the full ingredient list. And if you don't have the ingredient list, ask the person or that's making it. Really ask yourself, if you're making the elderberry syrup yourself, which ingredients do I really want in there, and how are they going to affect the baby? For lactating mothers, I would say on that note, a book that is a Bible is called Medications and Mother's Milk. And that is basically a database of all the different things that affect milk and how. And another question, should we make breaks while taking echinacea tinctures? Yes, breaks are important. I wrote that in my guide. It shouldn't be used. Echinacea is not a preventative. It is a treatment. So it basically stops working after a while. So unlike garlic syrup, for example, which is a preventative, or elderberry syrup, which is an herb that help you prevent you from getting sick, echinacea is to be used during illness and only during illness. Yes. Okay. Can you tell us where to get lemon balm and those? Oh, yes, lemon balm. So I grew lemon balm in my home in the Catskills this summer. And I grew it. I grew it because I love it so much, just out of respect for the lemon balm, which got so many of my patients through such serious viral illnesses. A lot of kids who have mono, I know that their illness duration was so much shorter because of lemon balm. It's an antiviral. It's also calming. So I grew mine. You can buy it. I'm gonna link it again. My PDF, which I just posted one more time, does have my favorite lemon balm Remedies. My favorite lemon balm brand is called Herb Farm, HERB Farm. Nose oil, my favorite nose oil herbalist is Raven Crest Botanicals. They're located upstate New York, and the owner of Raven Crest Botanicals, Susanna Raven, she grows everything herself with so much love and so much respect for the plants, and everything that is made with Raven Crest Botanicals is just such high quality. It's not a big brand; it's a tiny brand. It's a small company, and you could even connect with her through her website at Ravencrest Botanicals and ask her to make certain formulations if needed. So that's where I get my nose oil. Yeah, locally, freshly. Thanks, Goldie, for your question. This information is also amazing. Thank you for that. You're welcome. My pleasure. You say you teach students. Is this medical profession open to learning about holistic health? Are you allowed to teach this for medical students? Oh, thank you so much for asking the question. So it has to be presented in a certain way for the conventional world of medicine to be open to it. The way that it has to be is it has to be evidence-based. And so what that means is there's studies to back it up. So if I say something in medicine, I have to go, these are the studies, these are the good studies, these are the studies with high power, and these are the reasons that prove something. So whenever I recommend something, it might be traditional wisdom that our grandparents all knew, something that was kind of lost for a while, or it could be, but whatever it is, it's evidence-based. I thoroughly have to select everything, because if I don't have the studies to back it up, I can't just go, well, but we always did it this way, and that's how it works. So we want our conventional medical world to be this way. We want them to be kind of asking for the highest quality studies. Unfortunately, most high quality studies are studies in the world of pharmaceuticals where there's a lot of money made. There's just not a lot of money going into studies for cabbage leaves. And so my my study limit of what I could present with certain things are very limited, but there are plenty of international studies about things like the dangers of overuse of ibuprofen and acetaminophen. So I am allowed to teach students certain things that we talked about. But instead of just saying what I think is right, I ask them questions that help them open up their own mind. Like, for example, so what's the purpose of a fever? Is my favorite question to ask. So why do we get fevers? And they're like, I don't really know. Well, what happens when you stop a body from doing what it's supposed to do? Or so if I start just posing these open-ended questions, a lot of the students and residents kind of realize that they don't know everything that they might want to know, and they start looking into it themselves. So now it's been a couple of years since I've been doing these kind of lectures, and I don't present them as holistic lectures, and I don't say that, but the questions that I ask and the ideas that I offer, a lot of it is about microbiome. Is not, and that's not something that's addressed at all in conventional medicine. Conventional medicine doesn't really acknowledge microbiome very much as something of importance. So when I ask questions, open-ended questions that challenge their current viewpoint, they start kind of asking more questions, and so of themselves too. Yeah. Thanks for the question. Is there do you see changes coming in the mindset of pediatricians to be wellness focused rather than illness focused, more education minded versus ordering the parent? That's right, true compassion rather than fear. I hope so. Well, I don't know. I don't know what will happen. I think that as a parent, I start asking a lot more of my doctors, and there's a lot of practitioners that are kind of holistic minded, but there's not a lot of pediatricians that do it this way. So I hope that there's access to this kind of a care for everybody. I see change coming more than ever because the world of functional medicine is growing. The world of integrative medicine is growing. It's growing very strongly in the adult population. So I don't see it growing. There's a really big lag for pediatrics, to be quite honest. I think that I'm just one of 3 pediatricians in New York practicing this kind of medicine that I know because I looked for one. And when I saw that I couldn't find somebody for my own child, um, I, I felt responsible knowing what I know and or having a lack of information. I feel responsible to open up this practice because it needed to be done. And there are a lot of children who are suffering and being not being healed, but rather just symptom cover up, and that's frustrating for me as a doctor. So compassion is important. Fear doesn't lead to anything good. You're right, Ida. Thank you.
Dr. Gluzman, thank you so much. Thank you for being here with us today. We really, really appreciate it. I wanted
You're
to,
welcome.
Yeah, so what I want to do is we're going to be posting this webinar for everyone to be able to view if they missed it today, along with the ebook that you posted. Is that, so that's something that you feel comfortable, we'll share that as well.
Yeah, it was
amazing.
This ebook is like everything that I love, that I use, that I share with my patients, and you know, change it, use it, spread it. It's for everyone to use and see and love.
Thank you so much. That's so thoughtful and kind of you. I want to also just remind everyone that if anyone is interested in contacting Dr. Gluzman, like she said, you can go to her website and you offer these 15-minute consults free of charge, open to anyone, which is amazing. And also, like you said, having found someone like yourself in the New York area is really a goal. It's a big treasure because we don't have many pediatricians out there, definitely, and especially in New York. So thank you for doing all you do and, you know, taking it upon yourself to put yourself out there and to open such a practice and making yourself available to everyone. So thank you. And I just want to mention to everyone here, we hope you enjoyed the webinar. We are trying to expand onto different topics. And anyone who has a topic that they would like or has an interest in, we love feedback. So if there's a topic that you think would be a great topic to address, we would love to hear from you guys. And I would say just follow us on enrichparenting.org, follow us on social media, Facebook, Instagram, so you can see any upcoming webinars. You can sign up to receive our monthly newsletter. And we hope to share more information from Dr. Gluzman and to continuously, just as parents or as individuals, we continue to educate ourselves and empower ourselves in the decisions that we make for our own health and for our family's health. So thank you, Dr. Gluzman, for being here again. Thank you, everyone, for joining us. And thank you for all the questions as well. Thank you for participating. Dr. Gluzman, is there anything you want to? I just want you to be able to. Oh, did she leave? Oh, she might be gone.
Yeah, yes, she left.
Okay, good. We can lose you. Okay, we lost you for a minute. Okay, great. So, and anyone who wants, Dr. Gluzman, your website is
blossomPediatrics.com. Blossom Pediatrics. Yeah.
Okay, fantastic. And you can also, I know you're on social media as well, correct? Facebook, Instagram.
Yes.
Okay,
Yeah,
wonderful.
My social media is Dr. with DR _Gluzman, which is my last name is GLUZMAN. UZMAN. Please follow me.
Thank you. Thank you, everyone. Thank you, Dr. Gluzman, again. Have a great day. Okay.
Bye, everybody.